Associate Professor Nivet Nantajit, distinguished guest speakers, ladies and gentlemen, welcome all of you to USMLE Workshop 2009. This is our seventh workshop and it has been held since year 1991. Its purpose is to encourage and prepare medical students and doctors seek career advancement. Firstly, I would like to invite Associate Dean Siwapon Jankrajang to say some speech.
Dean Berk, Dean Nivet, Professor Somkit, colleagues and all participants. And the Faculty of Medicine, Chiang Mai University had the 50th anniversary this year. We were born on 28 October. And in order to celebrate and extol these foundings 50 years ago, so the faculty has organized this workshop, which we name it USMLE Workshop 2009. This will be a training session to prepare physicians for the USMLE. Actually, this workshop will be very useful. It's of great value for several persons. I think I can say that in the undergrad level, it will be very good for you to prepare to pass the license, the Thai board license. And for the postgrad level, any residents that would like to have the further training in America, they must pass USMLE. And furthermore, for the teaching staffs who attend this workshop, we will learn the style and also the way that each speakers that will deliver the talk, and then we can learn from them, and we also can learn current knowledge. There will be, for the speakers, I would like to inform you that we will have distinguished speakers, 9 from the United States, 9 speakers from Bangkok, and 10 from our Faculty of Medicine. Regarding the participants, we have around 300 participants, which are 40 from outside our faculty, and then our teaching staff, and also residents, and also medical students. 200 teaching staff members, and also the participants who have come here from different parts of Thailand. I would like to invite Dean Nivet to address the opening. Thank you very much.
Good morning, Dean Berk, Professor Techatat, Professor Somkit, USMLE reviewer from the United States and Thailand, and colleagues. On behalf of the Faculty of Medicine of Chiang Mai University, I am honored by the presence of so many reviewers who have come here to celebrate the 50th anniversary of the founding of our faculty. I know that Thai physicians in the United States, especially Professor Somkit, have given us so much assistance in arranging this training, including graduates of our faculty and other faculty in Thailand. The training session, in addition to being of immediate benefits for teaching staff members and residents who want to study further in the United States, will be useful for teaching staff members and medical students who want to assess the progress in education and for evaluating physicians in the United States. The USMLE is a guideline and accepted standard that leads to self-development and development of the faculty eventually. In closing, I would like to thank all the reviewers, especially those who have come from the United States, who have sacrificed so much of their time for this. I hope that trainees will benefit as greatly as the faculty hope. We have now reached the appropriate moment for me to formally open this training session. Thank you.
Then I would like to invite Professor Stephen L. Berk, Dean for Texas Tech University Health Science Center, to give second opening speech.
Dean Nantajet, thank you for inviting us. We're very pleased to celebrate your 50th anniversary and to help with the USMLE workshop. We have an excellent relationship between the two medical schools that we very much value, and it has been our privilege to have many of your students with us in residency training programs. We look forward to continued collaboration in education and research. And we believe this is a great opportunity to help teach students about the USMLE so that they have more opportunities to practice in the United States, around the world, or Thailand. Thank you for inviting us.
Thank you. I'd like to invite Dr. Somkit C. Daromon to tell a little bit about the goal of this workshop.
สวัสดีครับผมก็เชียงใหม่รุ่น4นะฮะก็ปลื้มใจได้กลับมาปีที่แล้วผมมาทำเดือนกุมภาพันธ์08ขอดูหน่อยว่ามีใคร attend เมื่อปี08สักกี่คนนะยกมือได้ป่ะไม่มีเลยโอเค so you're brand new โอเค What is the purpose of USMLE workshop? I can give you a brief background in 1991-92. The Thai Physician Association of America come up with the funding, $40,000 US for medical education in Thailand. And the first request is from one of the medical doctor who doing research in Boston at Tufts University. He doing research in nephrology and requests additional $8,000 for living expense in Boston. And the organization grant him $8,000. So for $40,000 you give $8,000. 20 or 25% already disappear. So I figured out that there's no way 40,000 can last if you give one resident for 8,000 or 5,000. So it happened that one resident showed up in Lubbock, Texas Tech from military Pamangkut Grau Hospital doing residency training in internal medicine. So you might remember for a long time the Thai government closed down the examination So nobody can pass an exam or take exam. You have to go to Philippines, Malaysia, or somewhere else to take ECFMG exam. So Dr. Chanwi told me that he self-studied and passed exam because he's top student from Pamukao and got trained at Texas Tech. So my idea is ECFMG workshop or USMLE workshop to educate many of us to come to pass the exam to come to US for training. Okay. So as you can see, the USMLE is United States Medical Licensing Examination ก็เหมือนการสอบบอร์ดใบประกอบโรคศิลป์ของสหรัฐ The base because it's uniform now. Before you have to take state Texas, California exam for licensing. So this is uniform the whole US. If you pass USMLE, you can go to any state. So that, and the USMLE very challenging. Even though it's so difficult, but I don't want you to be discouraged. I do not want to advertise that they have so many states. Like if you talk about 50 states, California, Minnesota, New York, Texas, each state have their own medical school, not only one. Like in Texas, we have maybe about 7 medical schools. Texas, the size of Thailand, 20 million population, Thailand 66 million. Texas have oil, cotton, natural resource, surplus, the weather like Thailand. Or you can go California and so forth. So all the option is better in US. If you go Germany or England or Switzerland or Australia, how many options you have? Limited. In US you can have more than 50 or 80 programs that you can apply. You can go into specialty, subspecialty, like you want to be internal medicine, surgeon, OBGYN. Like me, I train pediatric first, then I go to pediatric cardiology. Now today you can have subspecialty. Like you train cardiology, then you want to be cardiac catheterization, interventional cardiologist. You want to do interventional like arrhythmia, angioplasty, ablation. Or if you are so good, you can be neurosurgeon, one specialize, operate only brain tumor. Orthopedic surgeon, you want to specialize doing only spine surgery. So how many other countries have this option? US. So USMLE is your key or ticket for advanced training. The opportunity of research, you can do research during training while you do residency training. For example, in my time, I spent my fellowship at Mayo Clinic. I also do research, write a thesis. So 3-year program at pediatric cardiology, so I can have my master's degree in pediatric. But if you go to Mayo Clinic for surgery, that's 5 years, 6 years, you will have opportunity to be MD, not MD, surgeon, board certified in surgery, and PhD in surgery. Like Dr. Techatat, he MD, PhD in anatomy at Duke. See, once you spend a long period, you can do a research while you're in training. So that no other country have that. The reason to be fully trained, it gives you credit to take the board examination. So you be board certified specialist, like internal medicine, or you can be board certified in sub-board nephrologist, endocrinologist. So many of the reviewers that I invite to give you a review, we divide like a major surgery, OBGYN, then I divide in organ system, as you can see, endocrine, rheumatology, cardiology, neurology. So cover all the scope. It's not possible, right, to review all the medical curriculum in 5 days. So the material that we give to you is very high tech, because that is DVD. They have about 30 books. You can spend all your 1 or 2 years to prepare to take exam. The next one I want to talk about research opportunity at National Institute of Health. Thailand, or like here in Chiang Mai, we have NIH research in AIDS or other infectious. So you can link it to go to NIH for research. Like if you want to be physiologist, pharmacologist, biochemist, or you can go there for clinical training and research. United States still have a large amount of funding to support foreign graduates to come to US. Remember some of the student residents come and ask me, can I just go there to observe? ไปนั่งดู Today with HIPAA, patient confidentiality, you are out. So forget about go there reserve observer. It wastes time and money, wastes government money. You know how much it costs to go there 3 months, 6 months, spend time in US? Can be $500,000 or 1 million baht. You cannot even go observe in the round. You cannot open the patient chart. If it's not my patient, I cannot touch that chart. So you as foreigner, you go there, you're out, you're nobody. You cannot, the best you can do, spend your time in library. So why you want to go there just to be lab tech, go to library, read the book, you can do it here. The first key is you must pass with the highest score. Some of the members that I invite from Syria, those young blood, you want to be amazed, they pass with 99 percentile. So after Dean Berk give you the topic about how to take exam, these gentlemen going to give you how their secret to pass 98, 99 percentile. My simple is study, study, study. But not by yourself, don't be selfish. Form the group. Study and assignment, this one study neuro, this one study cardiology. Then you get together. The examination divided in basic side. That is our weakness. Because our curriculum is very weak in basic side. So you have to study very hard to pass basic science with 99 percentile or 98 percentile. You pass on a low score, just pass, forget it. You won't get it. You won't go. Because there is no second chance. The clinical side divided in CK, clinical skill, that is multiple choice exam. Then many years ago, they have clinical skill for the foreign graduate. That means you go to exam patient, take history, do physical exam. It used to be 8 patients, then 10, now 12. And most of the foreign grad who never come from English-speaking school, like Assumption or Mater, have a hard time to communicate with patient. Or sometimes if you have different accent, patient can deduct your point. So that's why we emphasize about clinical skill, and we're going to have dummy examination on the last day. We hope everyone pass and go there to take clinical skill exam. And step 3 is when you're doing your residency on second year, you take step 3 before you're going to be full license for American licensing. The material that we provide you is a high-tech, the girl who scanned about 30 books. And from this, you can pull in Adobe, read the format in chapter or in specialty, like you pull all the infectious disease chapter from different books. You can pull all the cardiology, neurology, basic science, pharmaco, and all that. So during the listening, I don't want you to sit around, take a note. Look at the screen, use your brain, follow the speaker, because we're going to quiz you and you have to respond the answer. And then if the question come up, majority of you can answer correctly, then we said, boy, they are smart. But if half the class didn't make it, then we know that what is the weakness. So don't be too bashful to click answer. Teamwork. If you have your roommate, your same class, 4 or 5 you want to go, you form a team, assignment, study. Make sense? Because you compete with the other foreigner, the Indian, the Korean, the European to go to US, and you also compete with American students. The other way to think that when you to prepare, right now, right now, if you are 3rd year, right? Basic science, you're good. Study. Because when you study basic science, you need to know that it's so different of our curriculum in Chiang Mai, Jula, Silat, or even the new school. The way they ask in USMLE is US standard, highest standard. And you have to know. If you don't know, you don't pass. So like behavioral science, some of the areas that we don't teach here, I bring the professor from Texas Tech to keep behavioral science review. Some of the basic science professors who come, they are PhD level. They have been doing review with me for many, many years. So that special gift for them to volunteer, and thanks to the Dean Berk to allow them to travel all the way here to give us a review. Just briefly, once you pass, or you make up your mind right now, I want to be a surgeon. Prepare yourself, prime yourself to be a surgeon right now. Correct? So any one of you want to be cardiac surgeon right now? Can you raise your hand? See? Good. I want you to thinking about what is the most need in our campus, our community in the northern of Thailand. What's the most need for specialists? Sure. Why do you want to go there to do a basic training? No need to, right? Because today we celebrate Center of Excellence. We would like to send 10 of you, 20 of you to go overseas for specialty training, subspecialty training, and come back to our campus to be a new blood. And there's a dual track, like I just said. You can go there in the major program like Mayo Clinic, Cleveland Clinic. You can do MD, PhD, specialty training. Again, like I just said, no second chance. It's not like take TOEFL. You can take so many times to get better and better. Here, you took the first time low score, that is your set. You cannot retake step 1, you cannot retake step 2. So you're not ready, don't take. Costs a lot of money too. So study very hard and take exam. The other one, we're talking about how to get one of your leg in there. You have uncle, you have auntie in Houston or in Lubbock. You will write the letter to the chairman, internal medicine, you want to do elective, spend 1 month. Or you want to go Minnesota, Mayo Clinic, spend 1 month elective. Look around how the program look like. Talk to the professor. I said, I love to come here to be a heart surgeon. Can I follow you? As a medical student, you can follow the route. With permission, like today we have Columbia University from New York that accept our student to spend time there in New York City. But that's very hard, right? New York City costs a lot of money to send there. But in Texas, almost like เชียงใหม่ เมืองบ้านนอก พลเมือง 200,000 รถก็ไม่ติด cheap cost of living and a lot of Thai restaurants. We even have cow soy for lunch. Briefly about life in US. Sure, some program you work very hard, but it's not as hard as Thailand. In US right now, they limited 40 hours. So if you on call by 4 o'clock, 8 hours. 80 hours. So they cannot use you more than 80 hours. In my day, when I start the residency, every other night, the next day I go to sleep, I on call the next days again, so, but not anymore. They limited the hour that you have to work on call. So you have a lot of opportunity to study, to do your own research or whatever. The key in here I want to emphasize is you go there, you need to come back to be board certified or sub-board certification. Now, many of you may be very rare here. I don't want you too much time. You already have Thai board. Like I'm already cardiac surgeon here in Chiang Mai. But I want to spend 2 years at Mayo Clinic to learn about coronary bypass or to do congenital heart surgery. You still need USMLE because that's license. You don't have license, you cannot touch the patient. Then we make agreement. Chiang Mai will pay you to go work at Mayo Clinic for 2 years. Special connection agreement, the dean already went there. That we pay you, you are cheap labor, on hand, scrub in every other day. with their cardiac surgeon and learn it and come back. But you are not be able to be bored. So what? You already have Thai board, so you can do shortcut. But I'm not encourage majority of you to do that. But if you already have skill, Thai people have good skill, dexterity. So you can go to be brain surgeon, orthopedic, hip replacement, joint replacement, or whatever, kidney transplant, liver transplant. I want to show this picture. Any one of you remember or recognize? Nope. You remember anybody? This is the picture of our first graduate, second graduate, third graduate, and fourth graduate. Chiang Mai used to be the #1 final exam in the nation. So the #1, first class, second class, third, fourth. I think you know Dr. Kasem Wattanachai, correct? Suthi Sutatna Yutaya, Sakchai Yu Lana Thai. Huh? Sakchai Ponprasad. Therayut Chamnan Wet, thoracic surgeon, you Connecticut. 4 of them got King's Scholarship to go overseas for training. But can you imagine only one scholarship to send? If you need 100 specialists, it would take a long time. But I want to remind you that we are #1. We are top. We need to be back to #1 again. Don't laugh. Don't laugh. We can do it. Just study hard, pass the USMLE and go overseas and come back home to be new blood, new staff. Briefly, I don't want to spend too much time. Last year, these candidates who participated in my ECFMG workshop, they all have Chiang Mai related. Dr. Virat, the white shirt with the necktie, our 19th grad, and met his wife, Dr. Napachawadi, here during the medicine training. They attended the workshop, so they both went to Texas Tech for internal medicine training. They both went to UT, Southwestern University, Texas, Southwestern Dallas. Virat is rheumatology, Napachawadi nephrology. They both at the Bamrung Rat. In the middle, Dr. Wan Pen, graduate from Chulalongkorn, went to UT Southwestern, trained medicine and cardiology. She also coming here for review cardiology. Next one, Alisa Limsawan, graduate from Lama, trained pediatric cardiology at University of California, San Diego, and came back to Rama Tibadi. Anybody know her? She trained medicine here in Chiang Mai and went to Houston for internal medicine and went to Mayo Clinic for endocrinology. So she also coming back here again to review endocrinology. So they all have Chiang Mai connected as internal medicine residency training. So don't be discouraged. They always have a chance for you, an opportunity to go overseas. Last one, we used to have money to sponsor visiting professor. Dr. Ponte, I visited him this past February. And he used to spend 6 months in Lubbock here at USMLE, so he spent time with me in cardiac cath lab. We exchange each other's skill, how to do cardiac cath, doing procedure. So now he directed pediatric cardiology at Chulalongkorn, do interventional, closure, ductus closure, ASD, or dilate coarctation, angioplasty. some of the nurses from different medical schools in Bangkok sent to Texas Tech for advanced high-tech critical care. And they came back home. And you can see the unit, modernized like University Medical Center intensive care unit, very modern, have respirator. Last one, this is what I want to show. It like a pom liquid. You understand pom liquid? The mother sent me the email, said, my daughter have double outlet right ventricle, very rare congenital heart. And lo and behold, I did my thesis on double outlet right ventricle at Mayo Clinic. So I emailed to Pontep at Chulalongkorn and said, 6 months old, heart failure. Can I send this baby to you for CAT surgery? Sure enough, the baby have CAT surgery, success, go home. By the same team, doctor and the nurse who came through Lubbock, Texas. So in my behalf of Chiang Mai Medical School, we want to thank Steve Berk for directly support or indirect support. Like when our team visit Lubbock, Texas in October 2008, they give us the most warm welcome than any other school. But I'm not trying to say they didn't give us a good welcome, but Lubbock, the best. Thank you.
Any questions? If anyone have any questions, please do not hesitate to ask, or you can ask in Thai.
เวลาพอไหมไม่มีใครกล้าถามโอเคคุยภาษาไทยก็ได้คนที่บอกว่าอยากจะเป็น cardiac surgeon ลองแนะนำตัวหน่อยสิครับขอไมโครโฟนได้ไหม
เร็วเธอเป็นโอกาสทองแล้วคนจะได้รู้จักไม่อยู่ข้างหลังครับผม
Good morning, Professor and everybody. My name is Silapop Thapmongkol. I'm graduate from Sirirat Hospital, and I will be to come to the fellowship of the cardiac surgeon in Cleveland. My dream is the congenital cardiac surgery, and I bring the knowledge and experience from the Mecca come to the Thailand for the help people. Thank you.
Do you know our famous cardiac surgeon who graduated from 9 graduate class who now in Sirirat? Somchai Siyochat. Yeah. Correct? Yeah. He didn't get invitation to go there to train. He ride the train to Bangkok and asked Dr. Kampon Pajomok, said, I want to be a heart surgeon. Can I come here to Sirirat to train with you to be heart surgeon? So the answer is, let's see how good you are for 6 months before I can tell you yes or no. So after 6 months, Dr. Kampon Pajomok said, you are good. We accept you to train under me. And he stayed on as young staff. In 1992, he came here give a talk when we have convention, TPA. and he present the congenital heart surgery that lowest mortality, 2% equal to US. So I want you to have positive feeling and ambition to follow out your previous graduate, no matter where you're from. As long as you're here in Chiang Mai doing residency training, med student, you study hard, you can follow like the senior member. Okay, I go to the next topic. I want to introduce you Dr. Stephen Berk, our dean. He also president, vice president for the medical affairs Texas Tech. Just a little bit different structure. Texas Tech have Texas Tech University and medical school. But at high level, we call health science center that have school nursing, pharmacy school, medical school, and allied health. So he in the medical affair. He graduated from Boston University School of Medicine, internal medicine, and his specialty is infectious disease, fellowship at the Boston City. He board certified the internal medicine and infectious disease and geriatric specialty. He used to be from Eastern Tennessee and subsequently moved to West Texas at Amarillo, chairman Department of Medicine over there, and then came to Lubbock campus to be a dean and vice president. So we would like to welcome Dr. Stephen Berk to give us a talk on the behalf of Dr. Tom Tanner, who's still en route to come here.
So first, I will go over the topics that Dr. Tanner had planned to present, because these are his slides. I'll go over them with you, and then I have my own insights about USMLE 1 and USMLE 2 from spending a lot of time working with our medical students, both in groups and individually. So let's start off giving you some very general discussion of the USMLE. And I think most of you will know some of this already. We'll talk a little bit about step 1, which is basic sciences, as you know, and for which our students take the exam after the second year. Step 2 is the clinical knowledge, the knowledge clinically about diseases, which our students take in the fourth year. And the much newer test, the Step 2 clinical skills test, which has only been given for U.S. graduates for the last 5 years or so, which was really meant to test less book knowledge and more the basic skills of communication, history, and physical examination. And I think you already know that international medical graduates are, of course, permitted to take the examination if they're from approved international medical schools, as you are. The pass rate for international medical graduates is good for all of these tests, although somewhat less than for U.S. graduates as a whole. And you always know what the minimum pass rate is. And an important point that I'll make later is that there are a whole variety of practice tests that you can do that will give you your scores, and those scores will correlate pretty well with the exam. So U.S. graduates know when they're ready to take the exam because there's so many practice tests that give them a score that's fairly reliable as a predictor. Scores fall between 140 and 260, and the means of various medical schools are different, range from 200 to 220 or so. Dr. Tenner says your goal should be to beat the mean, and I'll say more about that later on. So USMLE 1 is a multiple choice exam. It's divided into 60-minute blocks. And as I'll mention later on, it is very important as a first step to look at the website itself, which will give you a description of what is on the exam. Of course, that will be very, very broad and will cover lots and lots of basic science. But I think it can help you because what we do, or what we did at Texas Tech, is we compared our entire curriculum. We matched our curriculum with the website of the content described by Step 1, and where we saw that there were deficiencies, we corrected those. So if you were to see some material described for Step 1 that was not included in your curriculum, which I don't think there'd be too much, but there's always some, then you would pay special attention to those additional items that you would have to study. Step 1 and Step 2 are basically pretty straightforward multiple choice exams. And like I say, when I'm finished with Dr. Tenner's slides, I'll give you some of my own suggestions about how to prepare. As you know, Step 2, CS, is very different. It's meant to simulate a busy clinic. So you see 12 different patients. These patients are what we call standardized patients. They have been taught to give a very good history for a particular disease. We do a practice exam almost exactly the same as this exam for our students. They go through a very rigorous practice exam. The difference at Texas Tech, there's a faculty member that evaluates each student. On the exam that you will take, there is really no faculty member observing. There's a central observation center, but really the only evaluation comes from a standardized patient who is during the next day could be a secretary or a manual laborer or whatever, but that person is evaluating you. And we'll say more about what that means to be successful on that exam. Before you take the exams, you'll go through some of these details. Step 1 and Step 2, CK, multiple choice sections. During defined time to complete the items in each block. You may answer the items in any order, review your responses, and change answers. But after you exit the block or when time expires, you no longer review the test items or change answers. CS simulations are taken in a certain order. You're told to see the patients, the 12 patients, in a certain order. Before you take the test, you will be able to get familiar with what the software looks like, the navigation tools, and the exam format. So faculty members, we have, in the past, we have been given an opportunity to take the exam ourselves so we can teach better. But I have never taken it with this software, so I really cannot advise you about that. And I think you know that there may be pictures or video or audio components to the exam and lots of pathology pictures, and Dr. Graham and others will be advising you about that. And there will always be lots of laboratory values, many more laboratory values than you actually need. So you will have to actually determine what lab values are important and look those up, which will be different with each case. Step 1 includes only single questions. There may be many different response options. We talked about interpretation of a picture or a pathologic specimen. The one advice I give the students, if there's a picture or a path specimen, it is usually very classic and very obvious. So if you're looking at some little tiny detail, probably not looking at the right thing. I won't go over the specific questions. So Dr. Tenner gives some advice, but what I thought I'd do here, from here on in, is kind of give you the advice that I have picked up, like I say, in two ways. One, from trying to improve USMLE scores at Texas Tech in general, which we have done. We have taken the board pass rate from 82% to 98 to 100%. We have figured out how essentially to have all of our students pass USMLE 1. And also I have spent time with medical students individually, because medical students who can't pass USMLE 1 or USMLE 2 come to my attention because they can't graduate from school until they pass those tests. So for those that can't pass, we spend a lot of time working with them to make sure that they are able to pass. So let's start out with some basic things about USMLE 1. As is already said, this is going to be a test of your basic science knowledge. The one piece of advice as you prepare is to know that this test has been very controversial in the past with respect to what are the appropriate questions to ask. And so over the past several years, basic scientists in the United States have sat down together with clinicians to determine what is relevant to clinical medicine. Now, when we look at some of those exams, we are still surprised that some clinicians think that some of those tests are important for clinical medicine, but they have been reviewed between basic scientists and clinicians. And even though our students and many of our faculty are often critical of the USMLE 1, certainly critical of some particular questions, these questions, like I say, have been developed by a panel of top basic scientists and clinicians. So the first step I've already given you on USMLE 1 is to look at the website and see what topics they say are included, and then look at your own curriculum and make sure that all of those things have been covered at least in some way. So if you see some things that are very new, then you're going to have to spend extra time in looking those over. The other thing that we did to help improve our scores are all of the exams that the students get during their coursework is now in the USMLE format. So that gives us a big advantage because the students are so used to taking questions in the USMLE style. That's not necessary at every medical school, but you do need to be very comfortable with the single best answer approach and to really understand that there's a very specific format for the USMLE 1 questions. The USMLE 1 questions are now more and more in what we call a clinical vignette format, which means that even though basic science is being tested, most of the questions are for clinical cases. But you have to understand that those clinical cases are really testing basic science information. So if you have, for example, a patient with ALS, amyotrophic lateral sclerosis, it's not about the latest treatment or the latest diagnostic method. It's about whether you understand where the pathology of that disease is from an anatomical point of view. The USMLE1, the key is actually already been said by Dr. Samkid, is the enormous preparation that is necessary to do well on that exam. Many of our students talk about USMLE1 as if it requires tremendous talent, but really it requires tremendous effort and tremendous dedication to studying. Nobody is so smart that they do well on USMLE1 without preparing. So that's what it's really all about. Talking to many students, we recommend something like, thank you, 50% study and 50% doing questions. So you have to study hard, but you have to constantly be testing yourself. Kaplan questions, whatever is available to you. Our students do the USMLE World. There's many, many different books. There's many different online. You can learn from all of them. If you just take questions, probably that's not good. And if all you do is study, that's probably not good. It's a combination of both. Lots of taking questions and then going back and studying, especially to see what questions you did wrong. When we talk to medical students who fail the USMLE the first time and then pass it, they almost always say they can't believe that they took the USMLE1 the first time so unprepared. They didn't realize when they took it that they were not prepared to take it. And then when they do well the second time, it becomes very clear to them. So a very important point is not to take the exam until you're ready to take it. And to be honest, that's probably why we've gone from an 82% to 100% board pass rate, because the students understand when they're ready to take the exam because of all the practice tests that we do. We do something called the Comprehensive Basic Science Exam, which I'm not sure is available outside the United States, but it's very close to the USMLE1, and our students take it 3 times, and so they know when they're ready to pass it. It's also very, very helpful. Dr. Tenner talks about try not to be nervous, try not to be too anxious, try not to lose your mind while you're taking the exam. The best way to do that is to be very prepared and to know that you are very, very likely to pass the exam when you take it. If you take lots of practice exams, or if you're not prepared, or if you take practice exams and you get a score 1 point above passing, then of course you're going to be very nervous and anxious, and you should be. But if you take the exam when you're very well prepared, the stress level should be much, much less. Some of the things that students say, particularly when you're taking the exam, one mistake that everybody has noted is don't spend too much time on one question, especially if the question is confusing. If you're really confused about a question, it's very likely that you don't have the information you need to answer that question. So don't spend 5 or 10 minutes on that question, because it's going to be very counterproductive. The second thing we found is that there are some students who are what we call easily distracted by the wrong answer. So you read the case, you know the answer, but then you see a lot of very good alternative answers, and you move away from the right answer. For students like that, you may want to think the answer first before you even look at the alternatives. And if you come up with an answer that is on the list, then that probably is the right answer. But some students are more distracted by wrong answers than other students. Now I'm going to go to the USMLE Step 2 CK and say some things about the clinical exam. Basically, this is an exam that everybody should be on the same level with, because it's about the diseases that we all see, and it's the diseases are generally described for you in a classic way. There may be some atypical presentations, but for the most part, the diseases that are described in the clinical knowledge are classic disease descriptions. The problem for all of us, no matter where you train, is that as a medical student, you do not see all the diseases that would be included in that exam. So in addition to working hard during your medicine, OB, pediatrics, surgery, clerkships, you also have to go home at night and read and study. If you depend only on the knowledge that you get from the clinics, at least in the United States, that's usually not enough. So you have to read and work very hard in your clinics. There will be diseases that are not common that will be covered on the board exam. Ankylosing spondylitis or sarcoidosis or Chagas disease, some diseases that a clinician rarely sees, even in many years of practice, will be on the exam. But if you've studied those diseases, actually the questions will be very easy. So if you've studied sarcoidosis, even though you've never seen it, you won't have any trouble answering the very basic questions. One thing that throws students off is that the names of the diseases are usually not mentioned very much during the exam. So they may give you a picture of a patient who has Rocky Mountain spotted fever, not uncommon in the United States. You see a very characteristic rash, and then the word Rocky Mountain spotted fever never shows up on the exam. The question is, this person got the disease from A, B, C, D, and the answer is a tick. So you don't see the name of the disease, and sometimes that throws the students off. So you read the question, you see it's a classic disease description, you say in your mind what that disease is, and then you prepare to answer the question about that particular disease. To give you an example of the problem, I personally was tutoring a student on the CK exam. I told him when we were going over endocrinology that there is almost always a case of Addison's disease. I bet him that there would be a case of Addison's disease on the exam. This was a shelf exam, so I was able to look over the exam at the end. And so when it was all over, he told me that he was disappointed because he had studied Addison's disease, but it wasn't on the exam. When I looked at the exam, Addison's disease was on the exam. It was a patient with low blood pressure and an elevated potassium, and he just still didn't put the two together and missed that question. So you have to be very aware of the disease descriptions, but they won't be asking you what are the classic clinical features of Addison's disease. You have to find the diseases on your own. And then the last exam I want to talk to you about is the clinical skills exam. I know a lot about this exam for two reasons. One, I was invited to Philadelphia to critique the exam when it was just started for U.S. graduates. And also, like I say, Texas Tech, on the same day, all the students on all 4 campuses take a practice exam that is very, very much like the CS exam. So these are some of the things I want to tell you about the clinical skills exam, which, as Dr. Samkid says, may present some problems for some international medical graduates. So first, you need to know that it will look to you as if you're doing a clinic, and you will go to 12 different rooms and see 12 different patients. And I think you're going to have some examples of that later on in the day. These are individuals who do not have the disease. In fact, the board has determined that it's better not to use patients that actually have the disease because they then get off the script. They don't want anybody to get off the script. They've been taught exactly what to say when you ask the questions. First, I can tell you that all of the chief complaints will be very common chief complaints. In fact, I can almost promise you that there will be no rare diseases or very unusual chief complaints in the clinical skills exam. So what you can expect is what you would kind of guess. Headache, very common. I think you have some students that have taken the exam that will talk about it, but common complaints. One problem area for a lot of medical students are things like back pain, shoulder pain, ankle pain, wrist pain. Those common things are on the exam, sometimes not taught that well in some of the different clerkships. Internal medicine, shortness of breath, chest pain, almost always a case of shortness of breath or chest pain or syncope. In OBGYN, almost always amenorrhea or dysuria. Psychiatry, almost always depression, bipolar disorder, the common complaints. So you need to know, what do you ask a patient who complains of shortness of breath? What are the right questions to ask someone with shortness of breath? What are the important questions you have to ask in somebody with chest pain? In fact, there's a series of questions you ask in anybody with any kind of pain. How severe it is, where does it go, what makes it better, what makes it worse. Anytime there's a complaint of pain, there are very specific questions that you ask the patient. But the hope is that for common chief complaints, you know what to ask the patient. Then you have to know, for common chief complaints, what focused physical examination are you going to do? What I tell the students is, as you're getting the history, you can even think or write down, what physical exam am I going to do on this patient? You don't do the whole physical exam on any patient. There's no time to do that. There's only 15 minutes, about 10 to take the history, about 5 to do the exam. So if you have a patient, let's say, that has complaints of shortness of breath, worse on lying down, swelling of the feet, sudden onset of shortness of breath in the middle of the night that requires them to get up fast from their bed, so that you say that sounds like congestive heart failure, then when you examine the patient, you need a list of what is it that you're going to examine in this patient, in this specific patient. So you're going to look for jugular venous distension, you're going to listen for an S3 heart sound, you're going to see if there are rales at the bases, you're going to see if there's pedal edema. You're not going to waste your time doing a neurologic exam if the chief complaint is related to congestive heart failure. It's a very focused examination. And frankly, all of those things for you should not be difficult. Heart failure, headache, shortness of breath, it's the same, pretty much the same in one country to another. You know what questions to ask, and you know what exam to do. But there are some additional things on this exam, and they will emphasize that to you later. And that is that this standardized patient, well, first of all, for example, this patient, standardized patient with congestive heart failure, doesn't understand palpating for the PMI, point of maximum impulse, very well, but does know enough to know whether you felt for it or not. They will check whether you did everything you were supposed to do, but they don't really understand the techniques of exam very well. But what they'll also do is essentially evaluate you as their doctor. Do they want you as their doctor or not? Do they think you will make a good doctor or not? And so that is a very important part of this, is the communication skills, which you'll be talking about later on. Greeting the patient, being very polite to the patient. That's very easy. Good communication with the patient. Good eye contact with the patient. Having patience. One of the problems as we watch our students take this exam early on, they're very anxious to get the history. They're very anxious to figure out what's wrong with the patient. And sometimes they forget that just as important is in getting all of the facts is how well they're relating to the patient. So they have to listen to the patient. They can't interrupt the patient. They need to let the patient speak, but at the same time, they need to get all of the important information. So that's what the communication skills are all about. There is nothing that would, where points would be taken off for somebody's accent or taken off for, minor cultural differences, but points will be taken off if the patient doesn't think that this person will be a good doctor from a subjective point of view. And so that's part of the training with standardized patients. So I think those are all of the things that I wanted to say about this examination. Again, we should put this in a very positive light, in that passing the USMLE gives you great opportunities for additional training wherever you want to go. And while it is true that some specialties in the United States are very competitive, but there are many, many more residency programs than there are U.S. medical graduates in the United States. So the opportunities for postgraduate training at Texas Tech and at most other schools are still very good. So I wish you all a lot of success in taking your USMLE exams.
I can speak Thai while he prepared. Going to be a question and answer. Any comment? Too fast? เร็วไปไหมฮะเข้าใจไหมฮะ Okay. How rare the opportunity to have the dean of the medical school come and give this kind of talk to you. Very rare. So I want you to thinking about come up with a question to ask dean whatever you want to know. You can ask in Thai and then she and I will translate in English for you to ask the dean. Okay, first volunteer ครับเชิญเลยครับ First volunteer. Come on, don't be so bashful. Any question? How to get there? How light in Lubbock? เชิญเลยครับไม่เป็นแก้วถามงั้นผมจีนะผมงั้นคนนั่งหน้านี่กันโอเคเชิญเลยครับใช้ไมโครโฟนครับ
สวัสดีครับผมชื่ออโนไทยสุนสวัสดิ์นะครับ
Would you like to ask in English please This way you practice
in Thai would be better ภาษาไทยดีกว่าครับ
โอเค
ภาษาไทยนะครับ
King to ask in Thai I translate Go ahead
ถามเกี่ยวกับเรื่องการเลือกมหาวิทยาลัยเลือกรัฐอะไรอย่างเงี้ยครับว่าเราจะสามารถหาข้อมูลหรือว่าจะเห็นได้ยังไงจะหาข้อมูลได้ยังไงว่ามหาลัยไหนรับ IMG เยอะหรือว่ามีโอกาสที่ไหนมากกว่าอะไรอย่างเงี้ยครับจะหาข้อมูลได้ที่ไหนบ้าง
He asking about the opportunity selection of the training between state specialty or the option
So the opportunities for residency training in the United States does vary from specialty to specialty and definitely from state to state. There are still tremendous opportunities in all of the primary care areas. Pediatrics, internal medicine, family medicine, because the number of U.S. graduates in those primary care fields is still too low. And once you do your training in internal medicine or pediatrics, many of the pediatric specialties and the 16 specialties in internal medicine are still very available. In internal medicine, cardiology, gastroenterology, and now oncology and pulmonary are getting competitive, but still lots of international graduates go into those fields. Some specialties in the United States have become incredibly competitive for reasons that old-timers like myself really don't understand completely. But orthopedics, almost impossible. Dermatology, very, very difficult. Some of the surgical specialties like urology, ear, nose, and throat, very difficult, so that only the top U.S. graduates can get into some of those fields. But in general, many, many fields are still very much wide open. From state to state, residency programs in very rural areas tend to be more likely to be open. And even Texas Tech in Lubbock, 200,000, a city of 200,000, for some, that's too small. And so we do have some open positions in various places. And when you get into very rural areas, again, there's a lot of positions open. Also, some cities that are unattractive to U.S. graduates may have positions open also. like some programs in the middle of New York City may not be very attractive. There may be some openings. So the competitiveness depends on the specialty, and to some extent it depends on where in the United States the residency actually is.
Next question. Well, go ahead.
อีกนิดนึงนะครับ
Go ahead.
And are there any resources or anywhere, any websites I can have a look at this kind of information, like the differences between state to state?
Yes. Yes. Well, what you can do is available every year is the results of the match from the year before. So you actually have the ability to assess every residency program in the United States and see what percentage of match they had the year before. Then you can also go on the website of every medical school and see what the opportunities for international medical graduates are. Like if you go to the Texas Tech website and look at internal medicine, there'll be a picture of every resident and what school they graduated from. And you'll get a very good idea of how open that program is to various international medical graduates.
Okay, next question. Please, go ahead.
I've seen some programs, they tell us that the list of requirements for us, I've seen they need the US clinical experiences, which I don't know how can I get this to be a requirement for applying for the programs.
Turn microphone on.
There probably are some programs that would prefer that you came to the United States and did some training in the United States or some elective time. In very competitive programs, again, orthopedics is one example. They may even say they want you to have done an elective at that particular school if you're a serious candidate. Most schools aren't like that. More and more U.S. schools are opening up electives, fourth-year electives for international medical graduates. It varies from one school to another. Right now at Texas Tech, we don't have good electives for international medical graduates, but we are looking at trying to improve on that. But I think for the most part, what's most important is that you have good letters of recommendation, even from wherever you've done your training. And if you can get good letters of recommendation that show that you've had a rigorous experience in that field, I think most of the time that will be okay. Now, one of the things you need to get your professors, when they write a letter, to write a very detailed letter and to express that they really know you very well, because that's what professors in the United States do. We write and write about, how good the student is and how much time we spent with them. So those letters are very important so that there's confidence that you have done a good job and that you have a good work ethic and you always show up where you're supposed to be and you read and work hard and relate well to patients. So that's probably even more important than the actual experience in the United States.
Next question. Anybody want to be infectious disease? Can you raise your hand? Nobody? Come on. Please ask question.
My concerns is about the difference between the infectious disease in tropical area like Thailand and disease in the States. So my question is, most of the time in USMLE question, it will ask about the infectious disease in your country, right?
From a USMLE point of view, I think USMLE 1, not really. USMLE 1 asks about everything. So I help teach the parasitology, and I teach the students, so many things that they never see, never will see, and will be tested on. So for USMLE 1, I think that you may even have an advantage on some of the parasitic diseases and tropical diseases. On USMLE 2, you're right. USMLE 2, they're probably not going to ask too much about schistosomiasis or diseases that are not common in the United States. So you may have a disadvantage there. One thing that reminds me, though, about infectious disease that I do want to say, I think the reasons that medical students in the United States go into what they go into is really not all that clear. Sometimes it's because those fields have the most money. Sometimes, for some students, they think certain fields are easier than other fields. If you look at the fields in the United States where there's a high level of physician satisfaction, where physicians are happy they went into that field, it doesn't correlate at all with the competitiveness. Like a career in infectious disease in the United States is easy. A career in geriatrics is easy, not competitive. And yet those are two areas where physicians are the most satisfied. Orthopedics is very, very competitive, but when you do a survey of orthopedic surgeons, they're not that happy necessarily doing what they're doing. So the one important thing, don't choose a field because it's what's popular in the United States, because that could be a big mistake. Choose a field where you think you would be happy doing what you're doing. That's the single best advice we give to any medical student. If you just choose a field that you're sure you'll be happy in, the workload, the pay, none of that is really going to be important if you're really happy doing what you're doing.
Next question, please. No volunteer. Let's pick somebody up. Go ahead.
ขอภาษาไทยนะครับ ก็คืออยากทราบว่าถ้าจะสมัครสอบเนี่ยครับต้องจบแพทย์ก่อนหรือเปล่าหรือว่าอะไรก็ได้
His question, if he want to take the step 1 exam, that he have to graduate medical degree first or not?
To take step 1, I mean, in the United States, no, and in Thailand, I don't think that's the case. I'd have to check on that, but no, I don't think you have to have an MD to take step 1. Am I wrong? Does anyone?
You take when you in basic science year, that your best chance, same like in US.
Mm-hmm.
Even though it's a little bit different, the second year medical student in US,
Mm-hmm.
they in basic science, anatomy, physiology, so that equal to your, what year is that? เมืองไทย US ปี 2 ปี 3 okay, third year medical student here. You should start study and taking step 1 right now, no matter what. You wait until you graduate MD degree, your basic science is going to be forgotten. Any comment? Last question. Go ahead. On the back. Go ahead. เชิญเลยครับเชิญเลยครับ
ค ษาไทยนะครับ อังกฤษก็ได้ครับอย่างนั้น I would like to ask that I have heard that there will be audio question in the first step like a heart murmur or something. I would like to know whether there is a resource for us to practice, because in the third year medical school here equal to your second year in US, we don't really have much experience on the audio question. Thanks.
I'm not an expert on that, but I will tell you, I know online now there are some easily accessed and excellent audios on all the different murmurs you can come up with on the internet, heart sounds. I would think, I'm not that familiar with the types of audio questions that are on the exam, and some of the other speakers may know more about that. But specifically for the heart murmurs, I just went over this for a lecture that I had to give on endocarditis, and I found, great access to audios on the internet for heart murmurs. I think that you'll have no difficulty with that.
Thank you, Professor Stephen, for good advice. For the next session, we will use the PowerBoard that you can receive when you register. And if anyone don't receive, please contact the registration counter. And now it's time for break. Snacks and coffee will be provided for you in front of the room. And please get back for the next session at 9:55.